News for Today starts now.
Hey everybody, good morning and welcome to News for Today. I'm Angie Goff.
And I'm Richard Jordan. Let's get a check of your forecast now with Storm Team 4 meteorologist Chuck Bell. Good morning, Chuck.
Good morning, everybody. Temperatures right now, middle and upper 60s to right around 70 in downtown Washington. Plenty of clouds around for now. We'll have a lot of cloud cover off and on here through the next couple of hours. And a quick little passing sprinkle is possible this morning. And another little quick shower chance coming up mid to late afternoon today. But certainly will not be a washout. Many dry, usable outdoor hours.
Taking a look at our top stories now, police chief tells NBC News a NATO airstrike killed 15 people in Afghanistan. 9 of those victims were reportedly women and children. However, NATO says 10 people were killed in the strike. All were enemy forces.
The Obama administration is working to convince the country and the U.S. should take action in Syria. Today, the president's chief of staff, Dennis McDonough, will appear on several talk shows, including Meet the Press, and then tomorrow the president will do 6 interviews before addressing the nation on Tuesday.
Those are some of the stories that are making news today. Next is NBC4's Viewpoint.
And then we'll be back in a few minutes with another update.
Good morning and welcome to Viewpoint. I'm Jim Hadley. This morning we're focusing on women's health, from resources to how to empower women to make healthier choices. We have a big wellness event coming up on the 28th in Prince George's County, and joining us today, one of the big partners, the Reverend Dr. Gertie Hurley, Dr. Patricia Davidson, cardiologist with Medstar Washington Hospital Center, and Dr. Ernest Carter, Deputy Health Officer for Prince George's County. Welcome to Viewpoint. Welcome back, Dr. Davidson. Great to see you all. Thanks for coming in. We appreciate it. Let's start with this big event that we've got coming up. It's at Prince George's Community College. It is free and open to the public. What can women and family members, for that matter, find out and learn about their health when they go to this event?
Well, it's centered around the heart, cardiovascular disease, and so what we want to do is just call a celebration of birthdays, because we want to have people learn how to be healthier so they can have many more happy birthdays, healthy birthdays in their later years.
Dr. Carter, there are a number of exhibits out there and a number of partners with this event. There's also going to be screening and testing available.
Absolutely. Well, the health department, of course, encourages that, and there are multiple partners. From what I understand, it'll be there. The health department will be there, and it's important to get these screenings, especially for our women who are in our county, have some health problems that we would like to eradicate.
We talk about screenings and numbers, Dr. Davidson. What are the most important numbers for women to be aware of and keep monitoring?
They're the same for everybody, including children. Our waist size is one of our most important, because that leads us to so many other diseases, and we don't pay enough attention to that. We want women who are of color should be 31.5 inches.
Okay.
Women of European descent can be 35 inches, and there is a difference because women of color develop disease like diabetes and hypertension at lower body weights.
Interesting. Okay.
And men should be, men of color 37 inches, and men of European descent 40 inches. So that is very important, because fat around your midsection causes so many other diseases, especially diabetes, because it's all around and inside of your organs and your pancreas, where your insulin cells come from, inside of your liver, fatty liver, making sure that you don't have proper metabolism of your cholesterol. So that's a very important number we're just learning about.
Now, is that the same as BMI, or how is that different?
BMI
Okay.
is another number.
Okay.
You want your body mass index, which is an international global index that we now look at. And so this is worldwide data, that if you are above 25 body mass index and you are considered overweight, you most likely will die from that weight. And all the diseases that come with a higher body mass index, which is heart attacks, strokes, cancers, and your diabetes and your hypertension. So that's another very important index. And then we have our blood pressure, which ideally should be under 120 and under 80. We're kind of moving that up to 130 over 80, but that's because we don't see a tremendous difference between 120 and 130, so we move that up a little bit. And then our sugar should be 99 if we're fasting, and under 145 after we eat. We call that postprandial. That's very important because diabetes is a heart disease.
Sure.
So when you are diagnosed with diabetes, you're not going to have normal arteries. These are the things that actually clog our arteries. And we want our bad cholesterol to optimally be under 100, and our good cholesterol to optimally be above 50, and our triglycerides, which are the sugars we eat, to optimally be under 150. And not the total cholesterol, because that's not the number. It's not a total of those three numbers. We want to focus on the bad cholesterol, called bad because it's bad.
That's right.
So just remember, you want it under 100. And if you actually have been diagnosed with disease, like heart attack or stroke, or somewhere somebody has found clogged arteries, then you should be under 70, because there's a trend towards reversal if you can get your bad cholesterol under 70.
Wow.
So these are all very important numbers, because all of this is reversible.
That's right. You mentioned reversible, and part of the key to this big event is that we can take ownership of our health.
That's
and
exactly
these are
right.
things that we can prevent.
That's exactly right. And that's what we're saying. Take charge of your health. Eat more nutritious meals. Control your portions. Get up and move. And know your numbers. And that's what Dr. Davidson is going to be emphasizing, that she does that so well, as you know.
I'm taking mental notes and hoping that I can just play this back, because I really want to hone in on these numbers for life, really, for the rest of your life. If you keep this as the bar and remember those numbers.
And to make it even more simplistic, I like to tell my patients, if you don't like doctors and you don't like the pharmaceutical industry, there are three things that you can do to avoid both. Stay thin, walk every day or close to every day, and don't smoke. And you will eliminate 80% of the diseases that we acquire. And then you just have to worry about train crashes and Mack trucks.
Lightning strikes.
Lightning strikes, that's correct. And something that's hereditary that you have no control over. But you have control over 80 to 90% of our acquired diseases if you would do those three things. And then if you want to get fancy, you can throw in those numbers and make sure those numbers are where they need to be, and you will end up not having most of the diseases that we acquire.
Wow.
Isn't
We're
that
off to
simple?
a great start on Sunday morning. What a great way to kickstart our day. Think healthy. Dr. Carter, when we come right back after the short break, I want to hone in on Prince George's County, and specifically why we're talking about women in that county this morning. We'll be right back on Viewpoint, so stay with us. And welcome back to Viewpoint. Again, our focus this morning on women's health. And Dr. Carter, you had brought up Prince George's County, where, of course, you lead the charge there to turn some staggering numbers around. There are about 68, 69% of the county in terms of adult population is either overweight or obese. Now, those numbers are pretty reflective of African American and Latino numbers as well around the country. How do you get those numbers to turn around?
Well, it's programs like what we're talking about today. It's really getting people to change their behavior, and that is a large job, but something that we can do. It's we've got to target how people, again, eat, how they exercise, and not only just to target it by having, events, but we've got to do things that will change our culture of thinking. Because if you look at, for instance, obesity in Prince George's County and in the country, it's almost as if there is a cultural virus that occurred somewhere in the 1980s to 90s, now in the 2010, where our behavior, our health behavior changed, and it probably is consistent with what kind of information we're getting, how people, our kids are playing more video games, they're not as active, we don't have food, we have food deserts, and those food, before, instead of saying there were food deserts, we had farm food, fresh food. Now we don't have as much fresh food, but there's even more, there's stresses, and especially among African Americans and African American women. If you look at our statistics, about 75% of the women in Prince George's County are either overweight or obese. That's higher than the 68%. There's a little bit of disparities there. I think there's reasons for that. Has to do with there's stress, there is a lot of different, a conglomeration of factors, and it's cultural, they're different among different cultures. But I think the interventions that we have, and basically our attitude, and making sure that we understand that we have to get out there and help people change their behavior. I think we can
Hurley,
get there.
I want to touch on something that Dr. Carter had mentioned, and that is access and these food deserts, which we've reported on for several years now, and access to healthy foods and groceries.
Right. Well, I found out that over 70% of the restaurants are fast food restaurants. That's not a lot of encouragement for people. And I'm a member of Brown Memorial AME Church in Washington, D.C. A lot of our members are from Prince George's County. So I'm over the health ministry there, and we do cooking demonstrations. We do monthly blood pressure screenings. We do everything we can to try to get and Dr. Davidson has been there to talk to the congregation about healthy eating. So a lot of times it starts in the church because Prince George's County is known for a lot of churches and religious people, and they have functions and they eat.
Dr. Davidson, you see patients every day, and how difficult is it to instill healthy habits or to break the unhealthy ones in some?
It's extremely difficult because we have to recognize that the food industry deliberately made the nation addictive to their food.
They market it that way.
They market it that way, and they also know what they call the bliss point, the point in which a food becomes addictive. And we've been hearing about that lately. There have been books written on this, and they know exactly how much salt, fat, and sugar they can put into every food item, caffeine and other addicting substances. So when you put addicting substances in at just the right amounts, you make your food addicting. And then you see all the commercials that say you can't have just one. And so I always like to explain to people, especially when I do these events, is that if it's in a package and there's 10-syllable words on the side of it, it's probably going to kill you.
Wow. All right.
That you should shop on the outside of the grocery store with all. We live in Washington. We live in the South. We have the same fresh vegetables every month of the year, all through the winter. Maybe a couple of things like bok choy may not show up, but everything else is there all year round, and we can eat fresh all year round. Anything in the center, you just go into the center to buy your toothpaste and your laundry detergent and your soaps and creams and things like that, your toiletries, and you shop. Don't buy any food on the inside because
that processed stuff.
All that processed stuff, and so don't eat it out of a package, and we don't have to because we live in the South and we have fresh food year round.
The bliss point. You know, I had not heard that, but it certainly makes sense. We see it and eat it every day.
And people actually admit that they cannot stop eating certain food. So once you get them to understand that they have to have the discipline and that they basically had their minds controlled by an industry, then they finally say, oh, wow, this is... And you have to break that. Just as if you were an addict to alcohol or to cigarettes or to heroin or to coke. And all those things have never killed as many people as the food has. So we need to look at our own addictive behavior, and that's where the church plays a major role, because if you're a good Christian or a good Jew or a good Buddhist, you're not supposed to be addicted to anything. You're supposed to have total control of your mind. So so once you gain control of your mind, you gain control of your behavior, and that's how we have to go about changing our behavior.
One way to change the behavior and break some bad habits is this 30-day food and exercise journal. We're going to be right back to tell you more about this on Viewpoint. Stay with us. Viewpoint, we've got a big event coming up, as I mentioned, at Prince George's Community College. It is a celebration of birthdays, women's Wellness Day. I'll get that out yet. And it's a celebration of how we can live healthier birthdays and have more of them, truly. You have put together, once again, an incredible book here. It's a 30-day food and exercise journal. Reverend Hurley, tell us about this, and this is very user-friendly because you're really kind of grading yourself day by day, right?
Yes, and you're also looking at why did I jump off the boat this time? And so you can put down what was going on that caused you to do that, and then you can be encouraged when you look back and say, oh, that's what I did. And sometimes you're proud of yourself, sometimes you're disappointed, but it's also a 7-day suggested menus in there as well, and then you have recipes, and they're non-meat recipes because everybody knows where to get a lot of meat recipes, right? So this, and we haven't, a lot of people observe meatless Mondays, so this gives you some ideas of what you can do that still tastes delicious and low calorie.
That's a start. One day out of the week, go meatless. Is that one way to get people to change habits, is take the smaller steps, and then as opposed to, I'm never going to have another potato chip in my life or a French fry in my life?
No, you should wean. Remember, this is an addiction.
Right.
So you don't come off of heroin overnight. You don't come off of any addiction overnight, so you have to wean, and you try to find healthier alternatives to wean. So that if you're addicted to sugar, you turn to fruit. Now, fruit is still pure sugar, but it's better than having a candy bar. So you wean yourself by doing the fruit and then trying to do less and less of that if you're overweight or you're diabetic. And so that goes for everything. There are healthier chips than the deep fried, heavily salted. So they have some that have less salt. They have some that are made of corn and other kinds of items that are baked. And so you try other items which you find mostly at health food stores and are healthier. And actually, most of the grocery stores now have health sections. So you can find healthier alternatives as you begin to wean yourself from some of those addicting behaviors. But if you're snacking and you're overweight or you're diabetic, you know that you're not going to be able to lose your weight, and that's what the problem is.
You have a lot of partners in this event coming up on the 28th, Dr. Carter. This is something that we've had for a few years at Prince George's Community College. Mm-hmm. And if somebody is kind of on the fence, oh, I don't know whether I want to spend my Saturday down there, what kind of difference can this day make for them?
Oh, I think it can make a huge difference. I think if they want to learn about, really understand wellness, we have great speakers, we have ways for you to know your numbers, as we said, and I just believe, and it's well put together. I think they'll enjoy the day. From the health department standpoint, we really encourage these events. We have a few initiatives of our own that we're pushing forward and try to encourage this same type of events. We still actually do give out some dollars to, although the chili program went away, which was a program we had for a wellness program, we've actually revitalized that in the health department to the point where we've created a division for chronic diseases and wellness, and we've got a what you call a community transformation grant where we've actually given out some dollars to help people with wellness. And so at this particular event, we in Prince George's County feel that this is a reflection of how we can best help people get toward wellness, and I think they'll find it and they'll have fun. They'll be encouraged by their healthy behavior, so it'll be positive reinforcement, and I think they'll come away with a good day. And the only other thing I want to say is that the children will also benefit from it, because the pediatric obesity is running parallel with adult obesity, and in pediatric obesity we have to attack adult obesity and pediatric obesity. You can't really solve pediatric obesity without solving adult obesity, because the adults buy the food, honestly, and they also let you play video games, and they buy you the big gulps. Mm-hmm. So I think this is a family. I think the family benefits from events such as these, and I just wanted to be able to say that.
Reverend, do you find that people who want to tackle a big hurdle, if they're doing it with a friend or a family member, that makes it a bit easier for them?
Yes, and in the home, someone should be in charge of the health, like be the encourager. Take the first step. Make sure they get healthy food, as Dr. Davidson was saying. So you need a champion in each family. And if you don't have anybody living with you, just get a neighbor, a friend to be your champion.
Dr. Davidson, you contributed to Reverend Hurley's book here. One of the issues is portion control, and that is my big weakness. How do you deal with filling up that plate and going back and asking for seconds and thirds?
Look at what you're eating, because sugar is usually the addicting substance, or the things that become sugar, and that's your carbohydrates.
Okay.
Or your starches. I like to tell people that starch is for athletes, because it is the energy source that you need for your muscles to swim for 3 hours, play tennis for 8 hours, run a marathon. So if you're not an athlete, you can't have a whole lot of things that convert to sugar. Okay. So everything that you do, you look at your numbers and look at who you are. You eat for who you are, not for who you wish you were or who you used to be. So that if your bad cholesterol is too high, then you're eating too many animals. Your liver cannot handle your cholesterol and the animals that you're taking in. If your sugar is too high, then you know you're taking in too much starch and other sugary type substances. If your blood pressure is too high, you know you're taking in too much salt, and salt is for sore throats and for snow, and shouldn't be on the table.
I like that. That's easy to remember.
So just easy to remember. Look at your numbers, and if there's something wrong with your numbers, you look at the food that created those numbers, and you try to wean yourself from that food.
Wonderful. We've got one more break to take. We are getting some wonderful free medical advice this morning. This is our own personal doctor's appointment out there. Stick around. We'll be right back on Viewpoint. Women's Wellness Day coming up on the 28th at Prince George's Community College. I want to ask you, Reverend Hurley, about many of the partners that you've got in this. There are going to be dozens upon dozens of exhibits. Who's taking part?
Well, the major sponsor is Boston Scientific Close the Gap program, and then we have other sponsors: John 316 Christian Bookstore, Brown Memorial AME Church, Suburban Hospital, and Washington Hospital Center Medstar.
We have had a long partnership with Washington Hospital Center. In fact, I saw early this morning one of the ads that's running, and the focus on women has always been there. This particular spot focused on menopause and its connection to cardiovascular disease.
That's correct. Women have a protection, which is estrogen, which makes us women. And so we end up having our heart disease a little bit later than men, unless we do something like having diabetes, or we smoke, or become obese, then we lose that advantage. But estrogen does keep our arteries dilated a little bit longer, and it slows the progression of the cholesterol plaque. Unlike the male population, who will start having most of their heart attacks at the age of 50 in their middle ages, it'll take women to 60 and 70 if they don't do something to lose that advantage. So that was the purpose of that, to let people know that, especially pay attention to your risk factors when you reach menopause, because then the process becomes accelerated if you don't.
Outside of this event, Dr. Carter, you've got a couple of programs that you're working on there in Prince George's County.
Oh, absolutely. We have one initiative that looks at working with physicians to develop a wellness plan template that will help people with eating and activity. And we look at the doctor as the center for that advice. You know, that's where we found that people get their health information primarily from their doctor, then friends and family, and then from the literature. So we're going at the doctors and working with them and trying to integrate our public health with primary care to be able to allow people to follow the plan that the doctor says. And then we have community health workers that help them follow up on that plan. We also have an initiative that's called the Health Enterprise Zone. It's sponsored by the Lieutenant Governor in the state of Maryland, where we're in one zip code. We're trying to increase the number of actual physicians, because there's all about wellness. We need more doctors to help our residents, and we've got an active campaign in trying to help people understand how to better improve their health with that. And we have another initiative with Doctors Hospital in Jocelyn where we're helping diabetics, and there's really education around eating and active living. Last initiative is what we call Healthy Eating Active Living. I know a lot of people use that acronym, but we are developing that program so that our residents can take advantage of more books and diets and exercise programs.
We've just got a few seconds left, Dr. Davidson. Why the focus on women? Why are women targeted with these campaigns, and in particular your hospital's campaign too?
Because women are lead the health of the family. We don't think too many men will come out on Saturdays and Sundays, and women do. Women actually come out in huge numbers now. I'm quite proud of that, because I've been doing this for 30 years, and they wouldn't come out 30 years ago, and now they come out by the hundreds. And so it's not that we're eliminating men. They're perfectly welcome. It's just that we don't think they'll come out in the hundreds that the women will do. And they determine the health of the family. The food that comes in there, the food that gets cooked, is usually determined by women. And who gets the doctor? The woman will force the rest of the family to go to the doctor and actually accompany them there.
Makes sense.
We're not eliminating the men. We're just going to the head of the family and making sure we have the right people there to get the message to the family.
And if you come out, not only will you get a great healthy message, but you will also pick up one of these free copies of Reverend Hurley's book. We thank you all for coming in and making us wiser and hopefully healthier out there too. And thanks for having us in on Viewpoint. We're back again next Sunday. Now back to News for Today. Enjoy the rest of your weekend, everybody.